So what if you have shoulder pain and it's not because your shoulder is doing something wrong? What if another part of your body is doing something wrong, like your pelvis? Watch this. So what if your pelvis has some issues going on? There might not even be any pain with your pelvis, or I should say your hips, right? Pelvis and hips kind of go hand in hand. So what if they're not working right, and that's what's causing problems with your shoulders? Could very well be. Whether you're working out, right? Maybe doing some bench presses or flies or all the things that we do, shoulders, right? Shoulder press, that kind of thing. Well, what if it's because the hips and the pelvis are lacking mobility or stability, or both? So what does that mean, and how would you make sure, right? Or how would you know? Well, there's a way to test that and see if you got something lacking, and I'm going to show you. So say you're going forward. Well, what happens when you go forward? Does this hip do a nice little extension, right? Does it open up? Well, what about this one? How does that work? Is there a difference between the two, right? What happens if you step back and you want to make sure you're getting a really nice bending of that hip and that pelvis is doing that nice flexion? Well, what if it's not? Or what if it only does it well on one side? What if you're stepping out, and when you step out, you might have some pain going on here or here? That could be causing shoulder problems. Obviously with the left side, same thing, right? Right side, same thing. What if you're crossing over? And you're like, well, why would I do that? Well, there are times that you might cross over. That's a functional movement. It's authentic human movement. What happens if you can't do that? And what that means is the hip is adducting, or coming closer to midline with the leg. And what if that outer hip is not functioning right, but you don't feel any hip pain, but your shoulders aren't happy? What if rotation happens? What if I'm rotating away? So that's a nice external rotation of the hip, or an internal rotation of the hip. What if it's lacking? What if it's not working right? And that's the right. What if the left has the same issue? Your left foot comes over here, and you got a nice external rotation or internal rotation. What if you've got one side that doesn't do 1 or 2 or 3 or 6 of those motions? What if you've got both hips that don't do 1 or 2 of those motions? That could be causing shoulder problems. So isn't it important that you need to know that? And if it is, what do you do about it, right? So the goal is you test, you see if something's going on with either hip or both hips, and then you do some movement to try to restore that. And once that's restored or improved, you might notice your shoulders are performing a lot better. So say, I'll give an example. Say your hip is not happy when you do this, right? So that means that outer hip is not allowing control and lengthening the muscles on the outside of the hip. So if that happens, we've got to figure out how to restore that. Now, yes, you could have some structural image going on, right? That can happen. You could have some damage or injury to the hip. But what if that's not the case, and it's just because the muscles are not controlling the motion and allowing to perform with getting longer in that motion? So how do we restore it? Well, you don't want to just keep doing this, because if it's painful, you're only going to aggravate things. Your brain is going to say, guess what? My muscles aren't happy with that, so I'm going to find a way to cheat to try to not hurt myself, try to not cause pain. So it's going to use the wrong muscles, it's going to use the wrong pathways, trying to protect you, and you're kind of training in dysfunction. So a better way to do it is to kind of change that stepping to the side by maybe coming forward as you go sideways. So maybe if I come forward, right, maybe that feels okay. And so then what I do is I keep coming a little bit across, but because I'm coming forward, the hip's okay with going sideways. And as you continue with that, eventually you can do it where the foot is back more, and back more, and now you've got full adduction with no pain. You've restored that. Or maybe your body wants to extend when you go close. So now you're coming back, and as you come back, you're trying to get closer and closer, sideways, and you want to get as close as you can as long as there's no pain. Kind of find your threshold, and it's going to get better and better, but you're extending a little bit as you adduct. And as that gets better, eventually you'll be able to completely cross over and there's no pain. So the goal is to figure out how to restore that motion. And then what happens is when you go to do things with your shoulders, because the hips are working properly, the shoulders will work properly. Now, there is an issue that can happen with your thoracic spine, and that one's a little more, the best way to say it is that can really wreak havoc. And especially if, as you get older, your upper thoracic spine starts to round out and loses extension, that can really wreak havoc on your shoulders. And you might see, oh, guess what? I've got great range coming up, but your arm's way out there instead of here, right? So I'm going to do a teaching on that one so that you can improve thoracic spine and restore shoulder function. But right now, we're going to stick with hips, pelvis. So that's for the going sideways. For adduction, the same thing would happen with abduction, right? So if it's not performing properly coming this way, do it where you're coming a little bit forward, and you might notice, oh, guess what? It's okay with it as long as I come forward. Or maybe it works okay if I go backward. I'm still going sideways, but I'm adding going forward or back. Maybe you need a little, maybe you do a little rotation. So maybe when I go sideways, I need it to turn out a little bit, right? I'm not doing a full rotation like this. I'm just going sideways, but I'm turning a little bit to the right. Or maybe I'm turning a little bit to the left. You might need to have your foot that's not moving to turn out a little bit as you go sideways. And that might be where it's happy doing it. Or turning in just a little bit and going sideways. Okay, so you've got to figure out how to restore that stepping sideways, whether you're turning out, turning in, going forward, going back. And as it improves, there's no pain, there's no issues, you'll notice that you're better, and then you can do that full motion with no problems, and you may notice your shoulders are doing a lot better because of that. Okay? All right. So if you like this, hit the subscribe button. Hit the like button. Let me know if you have any questions, how this helps you. And next, I'm going to talk about thoracic spine. I'll see you then.